Okay, I'm here with my patient today, and she's 6 weeks out. Her name is Nervous Nellie, and she's a very nice person. But I'm just teasing her because she's 6 weeks out from liposuction, and she has some concerns. And I was just telling her that I think all of her concerns are just normal healing, and there's no need to be concerned about it. And so I just wanted to point out some of those things. But the difficult thing is that she's never been through this before. I have never been through this before personally, obviously. But I have, experience over many, many years with a lot of different patients healing from all different types of surgery. So I'm in a good position to basically say, yes, this is normal, or no, this is not normal. We need to intervene and do something. And so all of her concerns are really just concerned about normal healing. But I thought it'd be a good idea just to talk about it because I'm sure this is widely held by a lot of people. She's obviously not the first patient that's come in and been concerned about things that are okay. And so I just wanted to point a few things out. Now, one of the first areas that she told me about was this kind of raised area up here, and we'll show you her before photo, but she had like a little skin looseness and laxity here, and she says stretch marks. So you see the skin is a little bit sort of bunched up in some of this area, but this particular area right here is pretty hard, and so what we call that is induration, and that just means that the residual fat remaining behind, remember we can't take every drop of fat, we can't have skin just stuck to muscle, but the residual fat, the fat remaining behind after the liposuction, is indurated, meaning it's hard. And one of the things that actually she pointed out to me is that she had a lot of really large pores over here, but now they're a little bit smaller, and she had gone on Google and found that it looks like orange peel skin, which we call peau d'orange, which is just French for orange peel, because with the navel orange you get these large kind of pore-like appearance. But she also said they're getting smaller. So that's perfect, really, explanation is that when the pores are really big, there's more swelling. As the body heals, the pores get smaller. And so this is still very swollen because of the large pores, but they're getting smaller and it's moving in the right direction. And this is just an area that's more inflamed, more indurated, and it will be this way for a longer period of time. She had asked me if there was fibrosis here, but she's only a little, like 6 weeks out. So you really can't make the diagnosis of fibrosis at this time because everybody has got areas that are indurated, that are hard, that feel like fibrosis, but you can't call them fibrosis until it's a year after surgery because most people who have an indurated area, they don't go on to develop fibrosis. That all softens, heals, the swelling goes down, and their skin is nice and soft. And I anticipate that that's the way her skin is going to end up as well. But I could not guarantee that. There may be some residual scarring here, but we wouldn't be able to say, yes, you have fibrosis until it's 12 months after surgery. So how do you deal with this swelling? Well, number one, you need time, but there's no medication, there's nothing to take. It's just, I like to use a roller device. So some type of rolling device that goes over here that helps to soften this. And then massage either professionally or by yourself with just massaging the area with some type of lubricant on top, just like a lotion or daily lotion kind of thing, just to kind of massage all of this. That'll help that go away. And the other point of concern that she had was that she was really quite hard. She didn't know what this firmness was here. And this actually, I get this a lot. And patients are always surprised to find out where I say, oh, this here, and they're like, yeah, well, this is your abdomen. This is actually the abdominal wall, and it's really common for patients who have not felt their abdominal wall because they've had fat, that after you remove the fat, they're like, hey, what's this? I've got this is all hard down here. That's just her abdominal wall. She has a little bit of swelling. I mean, she's got a nice shape to her body. She has a little bit of fullness here, and if she wanted that to go away, that would be to lose a little bit of weight. Not a lot. I mean, just probably like 3, 4, or 5 pounds or something would really kind of flatten that a little bit. And then the other concern, I'm just going to kind of turn you around. Are you doing okay still? Yeah. Okay. So the other sort of concern she had was kind of in this lower back area. And it's a little bit firm as well. Very often patients will get firm on the side. I kind of call these like the rocks. It's almost like those hot stones you get put on you after massage. But she really doesn't have any of the typical kind of rocks, a little bit in here. But this is kind of firm. And that's just the exact same thing, and it's swelling. And you can even see that she has some bigger pores here. And one of the reasons why this area tends to swell more than, say, the upper back is because gravity. So all of the fluid that's coming down from the whole back is kind of congregating in this area. And so you can see this area swollen, not just from the lipo that goes on here. You can see these are her incisions. Not from the lipo, I mean, partly because of the lipo, obviously, but also partly because of the fluid coming down. So she didn't have a BBL. This is all her nice, beautiful BBL, but this, you know, it was a lipo that we did. So everything looks good, everything's normal, and you know, I think we just kind of went through all these things individually and talked about them, and just advised her, stay in your faja like you're in the faja for 3 months. Do the roller. If she wants to get massages, that's fine too. But definitely at some type of daily roller devices, not just on days that she doesn't get massages, but on every day. Actually, twice a day is really helpful if you can do it twice a day, to just, you know, do the whole roll, all of that. It not only helps soften and heal, but it actually also gets you some nerve regeneration, because it's not uncommon to have some sharp pains that come along, or some areas of numbness. And I think just touching all of that with the roller helps with the nerve regeneration too, which at 6 weeks, if you don't have any nerve pain, you might have it at 3 months. And you can get like a little zinger, something that kind of comes across, and the roller will help prevent that. So that's it. Thank you, Nellie.